Hello and welcome. I am Dr. Ramyajit Lahiri. I am consultant and in charge emergency medicine department, Narayana Superspeciality Hospital, Howrah. And with me today we have Dr. Arindam Ghosh, consultant neuromedicine, and we have Dr. Sudip Banerjee, consultant emergency medicine. Today we are going to talk about stroke on World Stroke. So, Dr. Ghosh, what is your take on this stroke?
Hello Dr. Lahiri, and a very warm welcome to all our viewers. On this World Stroke Day, the theme is time lost is brain lost. With every minute that a stroke has happened, a person loses 1.9 billion, in other words, nearly 20 lakh neurons in the brain. And within every ensuing hour, the number of neurons lost is 1 crore 20 lakhs, which is permanently damaged, not reversible again. Therefore, if you find symptoms of stroke in any of your relatives, friends, passers-by, or people that you know, you need to bring them to a stroke-ready center as quickly as possible, preferably in the first 4.5 hours to optimize stroke therapy.
So, it is the 4.5 hour which is very crucial, and as Dr. Ghosh said too, that time is brain. The more you lose time, the more the chances that the brain is getting damaged. So, Dr. Ghosh, what is your take on the stroke in compared to the age group? Because we are more familiar about stroke happening in older age, but now we are seeing a lot of cases coming with patients who are younger age also. So
that's right, Dr. Lahiri. 1 out of every 6 patients who have stroke can be classified as young stroke. Now, different authorities have different takes on what they consider young stroke to be. Some believe that young stroke should be classified for people who are below 49 years of age, whereas there are others, including myself, who believe that young stroke should be classified for those people who have stroke before the age of 45 years. Once you have stroke before the age of 45 years, there are a special set of reasons why you could have had it. Of course, they may have causes like hypertension or predisposing factors like hypertension, diabetes, dyslipidemia, age, obesity, and all of these could be similar between patients of young stroke and elderly stroke. But below the age of 45 years, there are certain other causes that can result in stroke. And they include, most importantly, some patients have a predisposition to developing thrombus, clots in their blood vessels. We call them a prothrombotic state. Some of these patients have holes in their heart through which clots propagate to systemic circulation and thereby reach the brain. Sometimes you could have an abnormality in the vessel wall inside the brain. For instance, you have diseases like the Moyamoya disease or fibromuscular dysplasia. There are abnormalities in the vessel wall which predispose to stroke. Also, habitual drug abusers, youngsters who are amphetamine addicts, for instance, are more predisposed to having intracerebral bleeds. There are certain patients, young of course, who have abnormalities in their coagulation profile. They have greater bleeding tendencies. So these patients will have bleeds inside the brain. These are the most important causes for young stroke, and patients have to be evaluated with NMR imaging, NMR angiogram to look at the blood vessel wall, certain prothrombotic factors, certain prothrombotic blood tests, and also echocardiograms, not the traditional transthoracic echocardiogram, but a transesophageal echocardiogram, which will look at the heart chambers close up and be able to pick up if there is a hole in the heart, like a patent foramen vein through which clots can propagate to the brain. So these investigations need to be worked on. Patients need to be worked up with these investigations. They would therefore therapeutically make a lot of difference because we have today in our setup here in Iran and the city over enough armamentarium to deal with patients with young stroke?
Now that we are talking about stroke, so let me just tell you that stroke can be of two types. One is ischemic stroke, that is the blood is getting clotted inside the vessel, and another is hemorrhagic stroke. That means the blood vessel is getting ruptured. So this two type of stroke should be dealt in a different way. Don't mix those two type of stroke into a similar entity. Now, Dr. Ghosh, can you please enlighten people, that the commoners mainly, so that it becomes very easy for them to identify stroke and come to seek help.
Thank you for the question, Dr. Lahiri. It's extremely important that you are able to identify the symptoms by which a patient will tell you that he or she has got stroke. Irrespective of whether the patient has ischemic stroke or hemorrhagic stroke, the symptoms are similar. And we try and remember it by this mnemonic called B FAST, where the letter B stands for balance disorders, where the patient feels unsteady or leans towards one side, finds it difficult to walk steadily. E, with regard to eye problems, where the patient loses vision in one eye or is not able to see on one side of the body. The F stands for facial deviation towards one side, or facial numbness. The A stands for arm weakness, numbness or heaviness, and that also includes leg weakness or numbness or heaviness, so arm and leg weakness or numbness. S stands for speech disturbances, where a patient becomes unable to speak. The patient loses his or her ability to speak or understand what is being said to him. More often than not, when you talk about speech problems, you will get a slurred speech commonly. If you have any of these symptoms, then your patient could have had stroke, and it is absolutely essential that you bring this patient to the nearest stroke-ready center. So the first thing that everyone needs to know is to look up which are the stroke-ready centers in the city. And it's preferable that you bring your patient as quickly as you can, preferably within the first 4.5 hours, to these stroke-ready centers, so that appropriate therapy can be instituted, so that we can help the patient recover as much as possible. Doctors Lahiri and Banerjee, in your lives you have dealt with multiple such cases that come to you within the window period, within the first 4.5 hours. In your emergency, which is very, very hit, how do you handle these patients?
Well, this is actually a very pertinent question. The thing is, as Dr. Ghosh already told, okay, if any of the symptoms, if you feel, which is suggestive of stroke, like be fast, what he has already told, that balance problem, or you have the vision problem, or you have a facial problem, or speech problem, or any limb weakness. So immediately you are supposed to visit to a doctor. Now that we have good stroke-ready center, so it is always advisable not to waste time and visit to a stroke-ready center as early as possible, because it is a 4.5 hour window within which, if you are presenting to a stroke-ready center, then with a medicine we can actually give that medicine, and the vessel which are getting clogged with that blood, those clot we can dissolve actually. So right now we are doing it, and we are doing it quite regularly, and the results are very good. Yes, there are chances of complication, but the rate of complication is only 4 to 6%. That is, almost 94% cured. So I will urge you to visit to a stroke ready center as early as possible to avail those treatment. Now the thing is, whenever you are coming to a stroke ready center emergency medicine department, so if the department is equipped, then definitely emergency consultant will see you and he will evaluate. There are international guidelines to manage this patient, and there are particular timeline is defined that how long it will take for them to assess, how long they are supposed to assess, and then within how much time they are supposed to send to for CT scan. Like the duration of a CT scan should be done within a 10 minutes from emergency to a CT scan. So that time duration is there. So all the emergency physician will do is to make you ready, and they will rule out whether you fit the criteria or not for a stroke appropriate candidate, and they will send for a CT scan so that they can identify whether it is an ischemic stroke or it is a hemorrhagic stroke. Because as I told you, if it is an ischemic stroke and if it is a hemorrhagic stroke, the management becomes different. Though the sign and symptoms means the presentation to you may be the same, but the stroke are very different in management per se. So in our unit, what we are doing is, this 10 minutes we have now reduced to almost 7 minutes, and we are doing it regularly compared to any international standard. And once we confirm that yes, it is a stroke, and then we discuss with patient and patient relative, if it is possible with the patients, and if it is not possible with the patient, then patient's relative, regarding the pros and cons of thrombolysis, and we go ahead with the thrombolysis. So this is the current, the internal standard treatment available, and right at this moment our center is fully equipped. If in case you don't know when the stroke has happened, which we often call it as a wake-up stroke, that is, you have gone to sleep in a complete perfect health, but once you got up, you don't know the time, you are having these stroke symptoms. So you might not be knowing that what is the duration of the stroke. Just don't worry. You come to the emergency department as early as possible with a proper MRI screening. We can find out whether it is within 4.5 hours or not. Even if it is not within 4.5 hours, we have now mechanical thrombectomy also available with us. We have those specialists also. So you are having actually advanced treatment possibilities with Narayana in our center.
Well, Dr. Lahiri very well said about our ED operation system to approach to the stroke basically. So we are having a very standard operating ED system to encounter the stroke. As I already told you guys, we are having a very per emergency medical system service. We are having a raid ambulance service to minimize the entry to the emergency. Basically, stroke encounter start from that EMS system. So as the EMS guys contact over the phone to our ED premises, as per the standard worldwide stroke encounter system, we started our operations. When the patient entered to the ED, within 5 to 10 minutes, we assess by our 24 hours consultant, ED emergency consultant. We diagnose the stroke, as well said by the Dr. Lahiri. We assess that there is a sign symptoms of ischemic or hemorrhagic stroke. We assess and we send to the imaging as early as possible. As the world standard treatment, we cut off our door to CT time, imaging time. 25 minutes we operating within the 25-minute system, and then after that we again last annual data we are just going to publish that thing. We cut off the stroke thrombolysis time period. Worldwide it is 1 hour system, we minimize to 45 minutes or little bit more to 45 minutes. and we diagnose, we do that CT angio also, CT scan and followed by CT angio, and we having that stroke code system. We announce the stroke code when the patient enters to the ED, and we minimize the whole duration, as well, that time is a brain. That is the newer agenda to the world basically. So after that we operate our system like this way, and when just as far as early as possible we reach to our diagnosis, we decided this is a window period stroke or not, and we proceed for the further thrombolysis.
I completely agree with you, Dr. Sudip. As you have told, our department is constantly actually maintaining this timeline very strictly, because worldwide the door to CT time is 10 minutes, and we are constantly doing it within 7 minutes, and the time of door to balloon, that is the door to thrombolysis.
Thrombolysis.
সে আবার প্রথম থেকে বলুন তাহলে।
আবার প্রথম
হ্যাঁ
আচ্ছা
Door to balloon.
I agree with Dr. And so
I-
CT 25 minutes.
স্টার্ট।
I completely agree with you, Dr. Sudip. As he has rightly mentioned, that our department is constantly doing it within the time frame, and we are trying to improve it further. The time frame for door to CT is 25 minutes, and we are doing it well within this period. And the door to thrombolysis time is 60 minutes. That is the international time standard, and we are doing it within 45 minutes constantly. Now, the thing is, Dr. Ghosh, once we do this thrombolysis, so how do you manage these thrombolysis patients?
The first thing that we need to know is how do we assess a patient before we do thrombolysis as a neurologist or a stroke specialist. We have certain scores, internationally accredited, acknowledged scores, standardized scoring systems called the NIHSS. An easier score is available with us called the RACE score today, which a lot of the stroke specialists are using across the globe. That will give us an idea on how big the stroke is, what kind of vessel the stroke has involved, and whether they will be amenable to thrombolytic therapy or whether they will require more advanced therapies. In case your patient is within the first 4.5 hours and is amenable for somebody who will be suited to thrombolysis and we administer a thrombolytic agent, we follow it up then with a CT angiogram, which is an investigation which looks at the blood vessels of the neck and the brain. And if the block or the clot is in the front of the brain, proximally, these are those that would be better suited to catheter-guided procedures, advanced catheter-guided procedures called mechanical thrombectomy, wherein we go in and take out the clot with a catheter and relieve the patient of his or her symptoms.
Yes, the best part here is we have now the studies have actually increased the duration of that.
So the duration of treatment for mechanical thrombectomy is 24 hours. You can still carry out mechanical thrombectomy up to 24 hours. And we are looking at studies, more and more studies which look at the possibility of mechanical thrombectomy beyond 24 hours. So I'm sure in the years to come, mechanical thrombectomy is going to be extended for beyond 24 hours. But as of now, up to 24 hours, we have state-of-the-art advanced therapies available with stroke. So my suggestion to everybody who's listening to us would be, if you notice stroke-related symptoms in your patients, or somebody who's a relative or a friend or passing by, bring them to a stroke-ready center as quickly as you can. As time is break, with every minute lost, neurons are being lost, and they are irreparably lost. They cannot be regained. So, if you notice these symptoms, bring them to the hospital as quickly as you can.
Yes, as we have already mentioned that this year the stroke day, the main headline is time is brain. So please don't waste time, and together only we can heal it up. It is not only by us, it is your contribution is also very much required. Thank you very much, and thank you Dr. Ghosh and Dr. Sudip for joining. Thank you.